Hello, I'm Professor Arif Türkmen and one of the plastic, reconstructive and aesthetic surgeon. Now I'm going to talk about post-bariatric surgery, what we do in post-bariatric surgery. Well, as you know, currently we have problem. People are putting on weight, most of them are obese and some of them morbid obese. It's not very easy to lose the weight. What they do, easily getting operation, lose weight. And then some of them actually, they lose the weight 50, 60 or even 70 kilograms. Their achievement is incredible. However, they get some problem. What happens? Well, the soft tissue, over bone or muscle, everything becomes 2 sizes bigger than their body. Skin start losing and sagging and then basically causes some problem, particularly around the tummy and lower abdomen. More lax tissue and sagging tissue causes, particularly in summer, more sweating and causes some kind of infection. And they get the hygiene problems as well. And then thigh get the more extensive sagging tissue. When they walk, they get the irritation and then just sweating more and then causing some problem. And then bottom flattening and sagging down. Arm basically again more loose tissue and then sweating more and causing problem, and the appearance doesn't look very good. And the face, due to the just excess skin and then all the soft tissue or losing the volume of the face, harmony of the face start losing it, and then balance of the body, everything is becoming changing. Gradually patients actually lose their confidence. They get in problem before operation or before losing the weight problem. After losing, they are facing with other problem as well. So how can we correct it? So on the body, basically making a knee waist and remove all the excess tissue and then repairing the muscle on the normal position, making a new actually belly button holes and then getting that in harmony and good shape. Sometimes on the back, if the patient has flattened and sagging the bottom, we call it 360-degree back lipectomy. So it means actually lifting up to the bottom, like the trouser, lift up, and then even sometimes we do increase the volume of the bottom with patient own tissue. In the thigh, we do sometimes liposuction to prevent actually lymphatic circulation and then remove the excess tissue and then lift up everything. We call the restoration of the tissue on the position and giving the good shape and then reducing the hygiene problems as well. Armpit, again, we call the Brachioplasty, and we do liposuction if we can do, and then remove the excess skin as much as possible. Breast as well, sagging like a balloon, deflated. There's not enough breast tissue, so we do actually lift up the breast and usually putting the implant as well. We do restoration of the face. Look at the face. What are the problems? How can we correct it? If the patient actually lose excess skin and then all the sagging tissue, we restore the every structures as normal as before, and then even patient needs the fat tissue, we put the fat injection as well and now remove the excess tissue as much as possible. Even after operation, we do very tight skin, gradually get normal position. Basically, if you are overweight, basically when you get operation and then you're having your target, however, you are becoming another problem. We are quite happy to help you on this situation and then look forward to hearing you. If you have any questions, please don't hesitate. Ring us, call us, and then come to our clinic. See you soon.